The biggest upset I've ever had in my life was finding out that I had cancer. That was back in 2017. I was diagnosed with stage 1B testicular cancer. Thank goodness it was found early enough to be a stage 1B. Now the downside of that was it was still considered advanced enough to go through a cycle of chemotherapy and of course also having the surgery to remove the tumor. Now during that time there wasn't much I could do in the way of training as far as physically training. And there have been other points in my life where my martial arts training looked very different from what we would consider to be normal martial arts training. Now the point of the discussion is that if you practice martial arts as a lifestyle, something that you just do, that you are, that you're going to have, eventually at least, changes in the season that you're in. And depending on the season you're in, your training should look different to accommodate that season. So in the case of having cancer treatments, couldn't be around people, I had very little energy. All I could muster usually was getting up to go for a walk if I was lucky, if I wasn't just totally sick on the couch. And I couldn't concentrate. So during that season, my training was down to very little. But I could still watch videos. I could still read books about martial arts. So I could still engage my mind and train my intellect in martial arts, even if I wasn't able to do much physically, and even if my focus wasn't great, I could still do something. Now, I've had a few other instances in my life. The first was all the way back in 2010, when I was only 21, discovering that I had a torn labrum on my right hip. That is the ring of cartilage surrounding the ball and socket of the hip joint. And anyone who uses their hips a lot in athletics is more susceptible to these tears. I'm particularly susceptible because I have shallow hip sockets, but I opted to try a repair for that involves sculpting my femur down and removing the cartilage tear. And part of that process was not using that leg for 4 months, so bearing very little weight on it, using a cane, and pretty much not doing any athletic activities. But what I could do was sit in a chair and run all my different hand techniques. So I practiced blocks and punches, and I would grab small weights and do the blocks and punches and do all kinds of things like that. Once my surgery healed up enough, I also hopped on one of the good old-fashioned Chuck Norris total gyms and did all sorts of, upper body exercises that weren't so intensive that they would cause damage to that area, like loading a lot of weight. So my season looked really different then too. In 2016, I was having all sorts of pain in my left hip, and I was doing PT, all kinds of things to try to solve that issue. And eventually I found out that for whatever reason, I had developed a bone cyst in the head of the femur on that left hip. And as soon as the doctors found that, they're like, you got to get that out of there because your femur neck could snap like a twig at any time. It's bearing way too much weight for what the amount of bone that's left. So they scooped it out and put a bone cement in and put 2 screws in. And after a few weeks, that hip was good to go. But there was a whole spurt leading up to that, and then of course a time recovering where I had to modify my training once again. That leads me up to current era, where I'm now experiencing the negative side of having that hip surgery on the right hip. I've got all kinds of bone spurs and miscellaneous cartilage, and the list goes on and on. For whatever reason, I've been able to live with it for years without much difficulty, but it's suddenly giving me a lot of trouble. So you may have noticed that this channel started out featuring a lot of kicking techniques, and then suddenly very few kicks were being presented, lots of pumse stuff and hand technique stuff. And that is why. It's because I am trying to recover this hip, get it into a better state before doing those dynamic kicks again, because they've just been causing it tons of problems. So my season, excuse me, my season right now looks different than it did even a few months ago. And that's just how it goes. If you train long term, you're going to have times where you have to modify your training. Now, if you're a martial arts student, I can't think of many instructors who wouldn't want you to come into class and modify the techniques and maybe not do a technique at all and do something else entirely while you're recovering from or dealing with something that is negatively affecting your health. We understand that it's better to modify or avoid and not exacerbate an injury so that you can be better off the next day. After all, that's what martial arts are all about, is being better off the next day. Prolonging your life, your quality of life, and protecting your life. Those are the attributes you want from a good martial arts program. Ian Abernethy says it very well: life preserving, life enhancing. So, just don't let your ego get in the way. Don't be too embarrassed to make those changes if you're going to a class. Understand that it's just part of the process in any long-term pursuit. You have different seasons. Now, if you're interested, if you yourself have had hip problems, I'll give you a little bit of information about that surgery. If I could go back, I wouldn't do it. When they did the surgery on my other hip, they also discovered that I have a labral tear on that side. And through physical therapy, I've been able to significantly reduce the pain to the point where it's very livable. When I got my first surgery, I was not offered physical therapy, and being only 21, I didn't really think to question the doctor. I just did what they said and got the surgery. Well, guys, anytime you have a surgery on a joint, you drastically increase the odds of that joint having issues. Another doctor just told me, even if you scoped someone's knee, didn't do anything to it, but put a scope in there, you can permanently cause issues to that knee. So, point being, I don't recommend these surgeries unless you have no other option, if you've exhausted everything else, just because you can't go back and undo them. Once you pull that trigger, you can't unpull it. And so, if I could go back, I would love to see if I could have figured out how to reduce that pain without having done the surgery, because that surgery has led to the bone spurring, the missing cartilage, basically arthritis in my right hip right now. So what am I doing about it? Well, looking at options through conventional medicine, and then I'm reading things on the internet. Now, I'm not trained in medicine, of course. Probably don't even need that disclaimer, but it's interesting to discuss. You'll see things out there about how avoiding like your carbohydrates, that kind of thing, with food really helps reduce inflammation. You'll also see that fasting can help reduce inflammation. And you'll even see some people say, and I'm not saying this is necessarily true, but you'll see people say that because of everyone's exposure to the spike protein through the virus, I won't say its name, I don't want to get my video demonetized or whatever they do. But we've all been exposed to this thing through one form or another, that it can persist in your body, and that doing these fasts can actually starve it out, if you will. Now, whether or not that's true, I don't know if it's true, but what I do know is it's pretty low risk to try the things they're saying, and the results would be very nice. They'd be great results. So low risk, high reward. I feel, why not give it a try? Over the past weekend, I did a 48-hour fast to see if I could reduce inflammation in the hip. And yes, it did reduce inflammation in the hip. Once I started eating again, I've noticed progressively that it's continuing to get better and better each day as well. So awesome. Resuming my eating, I've tried to avoid carbohydrates more than I normally would. It's very difficult, of course, especially if you eat lunches out, but I've reduced it down more than normal. And we'll see how that goes. So far, I have great things to report on that. Hopefully it's not temporary. But I'm a firm believer that whatever condition you're living with, you can find ways to reduce the pain enough that you can live with those limitations so that you don't have to avoid activities that you want to be doing. Now, of course, there are instances where that's just not going to be the case. But generally speaking, there's a lot we can try to improve the situation we're in before we give up on improving it. There are routes through PT, there are routes through dietary changes, there are routes through mind changes, I believe, that if you change your thinking, you can change how your body responds to healing. And so we shouldn't just give up on our lifestyle. We should fight for it and then try to get back to our normal training regime. Now, if we can't, so be it. That might just be the season we're in. But then we need to look at what we can do, not what we can't do. Because there's always something we can do when it comes to the study of Taekwondo. Guys, I'm curious what you've dealt with in the past. What have you had to overcome? If you would, drop it in the comments. Hope to hear some inspirational words from you guys and some of the health benefits you may have overcome. And understand, if you're newer to the study of Taekwondo, hey, you're going to run into something at some point. Don't let it discourage you. Remember, there are always ways to work around it.